My role today is to take questions from the audience and put some really hard ones, particularly to Nigel Lyons, but the other Nigels and Professor Shepherd. So if we have got questions, please text them and they will come up. But I might just want to ask a few comments. How do you not lose heart with the naysayers? So how do you navigate that?
From our perspective, we know that there's always going to be a queue of naysayers. So you don't worry about it. I mean, you've got to listen to what they say, because somewhere embedded in their message might be something that you can use in terms of adapting the technology. But you know, we all know in our professional lives that there's always going to be critics, and we just have to accept that and get on. That's life.
A key theme from all your presentations was around the need for collaboration and, I suppose, effective partnerships. How do you seek out effective partners? So perhaps, Nigel, how did you find your partners?
Well, I think the most critical thing actually is it relates to personality. You have to have a good working relationship with people. So I've had many occasions where I could have partnered with people, but you know, just to be perfectly frank, I didn't want to spend my working life with people who were not of the same ilk and didn't have the same passion. So I think the first thing is you actually just knock on some doors, you meet people, you talk to them, and you establish a relationship. Sometimes, you know, you can't find that relationship across the road. You know, so that's why a lot of our clinical partners, actually, with the Bionic Eye, are in Melbourne. But
so, Nigel, I suppose that raises an interesting point that sometimes we don't have choices about who our partners are because we just have to partner. If we're putting patients at the centre, we have to overcome personal differences. We have to cut our way through that to put the patient at the centre. So,
well, I think a couple of reflections. I think the first is that there's no doubt it always comes down to people and relationships and being able to communicate effectively, create the vision, create the sense of what people are trying to achieve, and where does that align with the other person or organisation's priorities as well, I think is the other critical thing. Because in the context of health system reform, it's not just about the individual person or team, it's also going to be about other organisations. We need to collaborate with non-government organisations, private providers. So it's about trying to understand, well, what are they trying to achieve? What are we trying to achieve? Where are the priorities aligned, and how can we work effectively together? And I think there is a need for us to understand what the other party is about as well before we can actually work in a constructive and collaborative way with them. We've got to understand what they're trying to achieve and how that aligns with what we're trying to deliver on too.
Now, are there questions from the audience as well? If anyone would like to ask a question, please put up your hand.
While we're waiting for a question, can I just say I was amazed by those presentations, the application of technology into clinical care. But what struck me most was the persistence of those teams, the amount of time that it takes to get these developments into making an impact clinically, and the fact that you work so hard to overcome every one of those barriers along the way. It's amazing persistence to get to those points that I certainly didn't appreciate until those presentations.
I think that sort of comes down to the concept of an inspiring project. I mean, these sort of projects that Nigel and I are talking about do inspire, the students and the researchers that are working in the field. It brings together some of the clinicians that are inspired by the concept and will give up time in their very, very busy schedule to spend quality time helping design these devices. So it's part of the nature of the projects as well.
Can you reflect on your journey? I mean, it's been a long journey. Are there lessons to be learnt about how paths you would have taken different roads? I mean, leadership's been a key, but what are some of the things that you might have done differently?
It's hard to know. I mean, there's a question there that says when your team is so dispersed and the effort spread across so many people, you must have to pay great attention to maintaining a sense of team. How do you personally do this with your big team? So, I mean, I think with a project like this, there is obviously the technical and scientific barriers you have to climb over. But one of the biggest risks to the whole project is the organisational risk. So it's exactly that, how you maintain the sense of team, the sense of unity of purpose, and it's not easy. Part of it's a big travel budget. You have to go, and you can't do things via email. You actually have to go to Melbourne, and Rob has to come here, etc. Otherwise, it just doesn't work.
And the group has a retreat each year where everyone gets together, and I think that works well. And we have conference call facilities, but travel is important because we've evolved to communicate like this face to face, and that's the best form of communication.
And one of the other things we have to do is cross-disciplinary education, learning a common language, getting the engineers to talk clinician and the clinician to talk techo speak, and somewhere in the middle the biomedical engineers acting as the Babel fish in between. It's quite a challenge.
Now I'm just going to ask you about your lessons learnt at the end, but we have got someone who's going to ask a question.
Health, that was actually my question about, I imagine you guys started off working in the garage or working in the lab. Now you're leading huge teams spread across huge geography. You probably spend more time now chasing money and keeping your team on track. So I wondered how you'd made that change from the doer to the leader of this incredible program. So you've answered that a little bit, but if you want to say more, please do.
Did you want to?
Well, it's hard. I mean, I would love to be back spending more time in the lab, but in this part of my career, I've got to put back so the next generation can have access to the wonderful privileges I had working under Graham Clark. So we've just got to build those facilities and mentor the next generation, because we know that the next generation are going to do things that Nigel and I have never even thought of, because they're incredibly talented. But we've got to keep on mentoring them and training the PhD students and the clinicians in a multidisciplinary environment, because one of the big issues that we find in a multidisciplinary environment is initially everybody's really too scared to ask the basic question because they think it's dumb. But the basic question really usually cuts to the heart of the issue, and part of the education of working in a multidisciplinary environment is being confident enough to ask a question that you think is dumb, because it's actually the key question.
And your point you've made about consumer involvement, so I'm going to ask each of you that. You've obviously highlighted it, Nigel. I know the ACI's got a strong focus on consumer engagement. Clearly that was something that underpinned. Right back when you first decided to go into the bionic eye, how did you engage people that were side affected?
Our clinical team at Sierra spent a lot of time through bodies such as Vision Australia and Retina Australia, talking to potential implant subjects about what they would want out of a device where they'd have to go in and have surgery, and all the issues around experimental surgery, and we got very, very clear feedback from them. And I think the clearest feedback was they mightn't receive benefit themselves. That's not a major issue for them. But if they're contributing to the development of a device that will ultimately allow blind people to see, particularly facial recognition, that they would sign up immediately.
Nigel, did you want to comment on the importance of consumer engagement?
Well, absolutely critical. I mean, I think we've made some strong inroads into involving consumers more into our work, but I think we need to go beyond even where we are at the moment. I mean, we're still, I think, designing the systems of care around what our health professionals believe should be happening. We need to come back much more to the patient, their family, their carers, and what's important to them needs to be designed in up front. And they should have a greater say in actually how that's designed. Our health professionals, we still, I think, we're still designing things from our perspective of what we believe they need, much more than we are actually going to the heart of what's important. But what struck me today out of a range of the different presentations is how critical that is, how important it is to actually understand what patients want, rather than us assuming what they want. And even in that discussion this morning about cancer care, and when do we have the discussion around how far we go in terms of active treatment, and when do we involve decisions around making decisions that mightn't be as active and are caring for people in a different way? I think they're really critical components. We do have this amazing technology that can be applied to improve outcomes for patients, but that component of the balance between the technology and the caring, it's a discussion we've got to have much more across the system. It's not just about the science, it's about how we apply that in the context of the people who are receiving the care. And that whole comment about what people wanted when they got their sight restored was be able to see the faces of their loved ones. I mean, clearly, of course. I mean, it touches you when you hear those sorts of comments. So I think that's what we've got to have much more discussion about as a system.
We've got a really good question about bringing together academia, health and industry physically together. And clearly your collaboration jumps states, but this question's posing you to reflect on, is that something we should be aiming to do more of? I mean, we have some examples of that in New South Wales. We also have some work that the Office of Medical Research is undertaking where they're coming out with a research hub strategy, which will draw on some of those needs for collaborations, including things like Medicare locals. But could you reflect on what you think of that concept?
I think it would be brilliant in that, as I said, for our bionic eye, we've had to partner with people in Melbourne. Not that it's a chore.
Not a problem, Victoria.
But we all know about Melbourne weather. But even with our telehealth as well, I mean, the investors for the telecare company that we founded came from the UK, and our trials were done there. The company had problems. It's gone under. It's come back up. It's now solely owned by an overseas company, although the R&D is still maintained here, and there's still 20 people and the regulatory approvals are done through the company here. So it's a lesson learnt, because if we could have had more effective partnering and investment here in Australia, in Sydney and New South Wales, then I think we would have had a much better outcome for not just the company, but for people who are suffering chronic disease in New South Wales. That was about a decade ago. Things have changed, and just this forum is an example of the fact that things are changing, and I have a much more optimistic view about how we will be able to collaborate and partner in the future.
Would you like to comment from the Melbourne?
Yeah, look, it's having academic, health and also commercial entities, because ultimately we're not going to do anything unless these devices are commercialised. Working together, it's hard work, and I think Nigel made a really good point before about each of the organisations understanding the drivers of the other organisations. Now, the academics are going to want to publish papers because that will help us ensure that at the end of a project, we'll be able to be competitive to get additional peer-reviewed funding. And the commercial guys will be saying, what are these guys taking a week off to write papers is a waste of time. We want the results now. So it does create tensions, and we have to understand the drivers for each of the different groups and what they want to get out of it, and respect those. It's hard work, and you've got to work at it every day. But the potential endpoint is incredibly powerful.
You spoke about the fact that things have changed, and so what are some of the things to get that collaboration? The thing that now, if you had a new concept, you could feel that you could interface with some clinicians and test it in the New South Wales concept. So what did you see as important?
I don't know if I can pin it on one thing. For instance, the Associate Dean of Research from Medicine came to the Faculty of Engineering last week and said, we need to collaborate more. I mean, it's a change in view, and it was, the Prince of Wales Hospital campus. They want to get more engaged in research, and I can't just say one thing. There's a medical devices fund initiative of $8 million that's new this year, and that's absolutely brilliant. It's the sorts of things that allow people to interact and collaborate. From my sense, I think that there's a realisation now that
collaboration is essential. That we don't all have the answers ourselves. Unless we can work with other people, look for different solutions, understand different approaches, work in partnerships. And I think as a health system, we need to embrace that. I mean, we know that there's no way we can deal with the challenges we're facing as a system unless we do create those partnerships. And being open to that, I think, creates all these new opportunities. And it's very exciting to be a part of that. And I think we need to ensure that we don't lose that momentum for collaboration, involvement of other parties, and starting to learn what else we can do.
Now, our final question goes to the telehealth. Could you give us a bit of a quick update on where the telehealth project's up to?
Telehealth.
Chronic disease.
Chronic disease. We've run smaller trials throughout Victoria and Western Australia and Queensland, and one in Blacktown. And it's a very difficult thing to trial to prove efficacy and improvements in patient outcomes, because you have to monitor over the course of the chronic disease, years, and you have to monitor a large number of people, and it becomes expensive. So I think it's hard to have the local evidence that it is effective, because it's not just providing the technology. You have to insert it into the healthcare, into the existing service delivery models. You have to have clinical champions, and it's a very difficult thing to do, but it's something that really should be looked at, I think, because it is one of the ways of reducing healthcare costs. I believe that even without having run the trials here in New South Wales.
Well, I think the ACI's got a strong focus on chronic disease and models of care relating to chronic disease. So I think even the fact that you're sharing a stage will promote that. Right. So can I thank you very much for your time today? And I'd like to call the audience to give a round of applause.
Thank you.